We've done studies with somatosensory EEG showing that you can reduce real pain, real shocks being administered by 50% within a tenth of a second if you're in a hypnotic state and imagining your arm is in circulating ice water, cool, tingling, and numb. Real pain. It's not that the pain, you're making it up in your head. It's the same level of pain. And yet, when Purdue Pharma talks millions of people into taking oxycodone, OxyContin constantly and gets them addicted because after 3 days you're on it, you get trapped in withdrawal hyperalgesia. 88,000 Americans died of opioid overdoses last year alone. It's been 300,000 in the last 4 or 5 years. It's appalling. And now that's dangerous. And yet somehow talking to people and having them concentrate on floating in a bath, a lake, a hot tub, or floating in space, and imagining the part of their body that hurts is warm or cool or tingling or numb, that's somehow either useless or dangerous or both.
Welcome back to the Smarter Not Harder podcast. I'm your host today, Jody Duval. And on today's episode, I'm thrilled to welcome Dr. David Spiegel, a globally recognized psychiatrist and a pioneer in mind-body medicine and hypnosis. Dr. Spiegel serves as the Associate Chair of Psychiatry and Behavioral Sciences at Stanford University and as a director of both the Center on Stress and Health and the Stanford Center for Integrative Medicine. With over 50 years of groundbreaking research, Dr. Spiegel's work focuses on how the mind influences physical health, particularly in stress management, pain relief, and cancer care. In our conversation, we'll explore how modern hypnosis works, the science behind it, how it can be used to manage pain, support, and quality of life for cancer patients, for sleep, for stress and anxiety, and how that has massively increased in the world recently. And we also dive into the fascinating intersection between stress and the immune system, chronic illness, and how psychosocial interventions like hypnosis can offer really real and measurable benefits. So Dr. Spiegel shares insights from his long career, including innovative approaches and stories and his technology, and how it's expanded to access hypnosis and trying to support the wider community with his app, Reverie. So also his personal journey into this transformative field. And he makes me cry. It's a beautiful person, and I really, really enjoyed this conversation. So if you love the podcast here or any of the podcasts, please give us a review, a share, and a like. And your support means the world to us, and it keeps us bringing you the content that we have here. So without further ado, let's welcome Dr. David Spiegel to the show.
All right. Welcome, Dr. David Spiegel. It's an honor to have you on the Smarter Not Harder podcast.
Thank you, Dr. Jody Duval. Glad to be here.
What an incredible career you have. It is reading and researching. I am absolutely honored to have you here today and speak to us about your incredible, well, as you said, over 50 years of hypnosis focus, but also many other facets of your practice as well.
Yes.
And so there's so much that I wanted to dive into, but I always love to start with your story of how you landed in psychiatry and what sparked your interest, particularly in hypnosis for that matter.
Well, Jody, actually, I had no choice at all. Both of my parents were psychiatrists and psychoanalysts. And so they told me I was free to be any kind of psychiatrist I wanted to be. And here I am. My father he was just heading off to serve in North Africa in World War II. His analyst from behind the couch said, Herb, you want to learn hypnosis? Hypnosis was not popular with psychoanalysts because Freud gave it up. So who were they to do it? And my father thought, what did I say wrong that he's now making this suggestion to me? And it turned out that there was a Viennese refugee named Gustav von Aschaffenburg who had escaped from Austria and wanted to serve in the U.S. military, but couldn't because he wasn't a citizen. But he was an expert in hypnosis. He was a forensic psychiatrist. he had a smallpox scar in the middle of his forehead. And he noticed that a lot of the prisoners he was interviewing would sort of focus on that smallpox scar and sort of nod off. And he got interested in what was going on. How would their attention get so focused on one small thing? And how would they go into a different mental state? So he volunteered to teach young Army officer physicians how to use it. And my father found himself using it in combat to help soldiers with pain and combat stress reactions. And he came back and he sort of went back to psychoanalysis, but he found that he was doing better in a very short time with some of his patients he still used hypnosis with than the analytic cases. And so the dinner table conversations were interesting. And as I got older, I could go watch and make movies about the patients and so on. So but you have to decide first you're going to do 12 other things before you come around to doing what it looks obvious you should be interested in. And I was on my pediatrics rotation at Harvard, and the nurse says, Spiegel, your next patient is in room 348. She's in status asthmatica. She's been hospitalized 3 times in 3 months, and we're considering general anesthesia. So I walk in, and here's this pretty 15-year-old redhead, knuckles white, struggling for breath. They had tried subcutaneous epinephrine twice. It hadn't worked. And her mother's standing there crying. And I didn't know what to do, but I had taken a hypnosis course. I figured I got to learn something about it. So I said, well, would you like to learn a breathing exercise? She nods. So I tell her, well, each breath you take will be a little deeper and a little easier. Very subtle, very clever. But she was hypnotized and she listened. And within 5 or 10 minutes, she's lying back in bed and she's not wheezing anymore. And her mother stopped crying. And the nurse ran out of the room. My intern comes looking for me. And I thought he was going to pat me on the back or say, what did you do? He said, I need to inform you that the nursing supervisor has informed me that you violated Massachusetts law by hypnotizing a minor without parental consent. Now, you're an expert in naturopathy, all these unusual, at worst, not harmful treatments, sometimes helpful.
Yeah.
So I had broken a non-existent law in Massachusetts, and he said, you've got to stop doing this. And I said, well, tell you what. I said, you're going to put her on. And I said, why? He said, it's dangerous. I said, well, you're going to give her general anesthesia and put her on steroids, and you're telling me that my talking to her is dangerous? I don't think so. So as long as she's my patient, I'm telling her what I think is best for her, and you can take me off the case if you want. So he stormed off. There was a council of war with the chief resident and the attending, and they came up by next Monday with a radical solution to the problem. It had never been tried before. They said, let's ask the patients. And she said, oh, I like this. I want to keep doing this. So I did. Now, she did have one subsequent hospitalization, but she went on to study to be a respiratory therapist. Mm-hmm. And I thought that anything that can help a patient that much, that fast, that safely, and violate a non-existent law had to be worth looking into. And I've been doing it ever since. Mm-hmm. And it just struck me that there's this sort of paradox that I'm sure you've experienced in your career too, where these things that are just teaching people how to live more sensibly, how to use their brains better. I think of it as something like physical exercise. It's good for your body if you do it. Well, using your brain in ways that can help you control pain, control anxiety, get to sleep, stay asleep, stop smoking, should be a kind of mental exercise that we think of as every bit as important as physical exercise, but we don't do it. Mm-hmm. So I've since then used hypnosis with about 7,000 patients and research subjects in my career. Mm-hmm. And I just want many, many more people to be able to benefit from a simple, straightforward exercise in using your mind better.
Yeah. The paradox is real, and it's so frustrating. And so I completely sympathize and recognize what you say here. And it's, it almost gives you fire under your belt to get you moving, doesn't it? When you get told that the most simple things that have no side effects can then not be used or supported, yet things who have such high levels of risk and almost poisonous any medication, really, like there's so many side effects seen from these.
Absolutely, Jody. People have told me hypnosis is dangerous. How could it work for pain? If the pain is real, it won't help. Well, you know what? We've done studies with somatosensory EEG showing that you can reduce real pain, real shocks being administered by 50% within a tenth of a second if you're in a hypnotic state and imagining your arm is in circulating ice water, cool, tingling, and numb. Real pain. It's not that the pain, you're making it up in your head. It's the same level of pain. And yet, when Purdue Pharma talks millions of people into taking oxycodone, OxyContin constantly, and gets them addicted because after 3 days you're on it, you get trapped in withdrawal hyperalgesia. 88,000 Americans died of opioid overdoses last year alone. It's been 300,000 in the last 4 or 5 years. It's appalling. And now that's dangerous, and yet somehow talking to people and having them concentrate on floating in a bath, a lake, a hot tub, or floating in space, and imagining the part of their body that hurts is warm or cool or tingling or numb, that's somehow either useless or dangerous or both. And it's just wrong. It is just wrong.
It's almost hilarious, isn't it? When I get these sorts of stories and clients will tell me things, I just literally laugh out loud because it's like, how can it be so much more further than the truth? What sort of reality are people seeing?
I'm a doctor. I use drugs all the time. I use meds with my patients, but a lot of what we do in healthcare is being pushed around by big business, by big pharma, who have interests that they want to defend and protect and expand. And sometimes the drug is not the answer. Sometimes it is, but sometimes it isn't.
Absolutely. It's about the full toolkit and actually giving each of its validity of what it actually can be doing. So let's start from sort of like a simple 101, just for those who may not have, and I'm sure everyone has heard of hypnosis, but let's just cover that off. What is modern hypnosis? What is and how have you seen it work? And you have over 400 studies, I believe, or probably way more than that now. And it's incredible. And I was reading some of your cancer research as well, your cancer care, which is a big interest of mine also, but also to see in terms of the shift of what I see in my clinic in terms of anxiety and stress, even in the last 3 years. So it must be so fascinating for you to see a big shift in not only your industry and your profession, but also in how people have changed with the comings of technologies and comings of all sorts of different environmental things that are going on for us as well, including COVID. So let's start, I guess, with the basics of what hypnosis actually.
Pardon the interruption, but this podcast is proudly brought to you by Home Hope's Gut Immune System module, an advanced learning framework designed to help practitioners unlock the power of clinical gut health management. Developed by Dr. Ted Achikoso, this module is part of the essential pillars of health optimization, medicine, and practice. And so if you're ready to offer solutions beyond symptom management and get to the root of patients' health and treat health, not disease, the Gut Immune System module is your pathway. So you'll gain knowledge to identify and correct imbalances such as dysbiosis, inflammation, food sensitivities, and empowering you to create personalized health support with precision. So want to take your patient care to the next level? Then visit homehope.org/product/gut immune system and use promo code podcast10 for 10% off. Whether you're a doctor, practitioner, this is your chance to deepen your expertise and transform the way you support your clients' health. Now, back to our conversation with Dr. David Spiegel, where we continue to explore the fascinating mind-body connection.
Have you ever gotten so caught up in a good movie that you forget you're watching a movie and enter the imagined world? Does that happen to you? You're in the movie, not in the audience. Yeah. And have you noticed that your brain is not only good at focusing in so much, hypnosis has been called believed in imagination. It's really highly focused attention. But one of the ways you accomplish it is by dissociating. That's the second part of hypnosis, putting outside of conscious awareness things that ordinarily would be in consciousness. Now, right now, Jody, you've got sensations in your body touching the chair you're sitting in, I presume. But I hope you weren't aware of those sensations while I was fascinating you with what I'm saying about hypnosis. Is that right? Yeah. If you were, we could just stop now. So the brain is processing thousands of ideas, signals, sensations all the time. And the way we get to do anything is by putting most of them outside of conscious awareness. We call that dissociation. In more extreme forms, that happens when people are in terrible traumatic situations. They just don't get the big picture. They focus on what they need to do to stay alive or to defend and protect themselves. So hypnosis is a naturally occurring state in which you focus attention, you dissociate. And the third thing, it's the thing that scares people the most, is what used to be called suggestibility, but what it really is cognitive flexibility. That in fact, you turn down activity in the posterior cingulate cortex, the default mode network, where you think about who you are and what you should be and what people expect of you and what your mother wanted you to be and all that. And you just shut that off and try out being different. And so people who do heroic things, guys who've gotten the Congressional Medal of Honor in combat say, I have no idea how I rescued that guy. I know there was fire everywhere. I didn't notice it. I was just doing what I had to do to save him. So people can try out being a different person than they expect they are. So when you go to a show in Las Vegas and some stage hypnotist has the football coach dancing like a ballerina, I don't like it. I don't like making fun of people. But there's actually a useful point there. And the point is you can, in a hurry, discover how different you can be from who you think you are and what you think you can do. And that's not in a bad way. That's in a good way. You can be in a situation where you've been injured, you have pain, you don't want to take more opioids, and you can actually manage the pain. You can find out. We had a guy wrote us at Reverie, our digital hypnosis app, saying that toward the end of his life, as he was getting older, he had a tumor that sort of wrapped around his spinal cord, and it was causing him terrible pain, just impossible pain. And he tried meds, and they didn't do much except get him addicted. And he said, I learned to use self-hypnosis, and it transformed my life. It was there. I couldn't, but I knew I could deal with it. I could alter the pain. I could pay attention to other things, and I just didn't let it get me in the way that it did before. It's something he didn't think was possible. And he was a doctor. He knew all the neurophysiology of pain and all that. So people can learn to be different than they thought they were and deal with very effectively symptoms and problems that they didn't think they could manage.
Yeah, absolutely. I myself had little bits of dabblings of exposure to hypnosis in my teenage years. But then through both of my pregnancies, I did hypnobirthing. So I was learning the hypnosis techniques to have effective management through my births, and ended up, first was an assisted hospital birth, but no pain required, pain management required. And then through my second, it was at home in the pool, in the birthing pool with hypnosis techniques. And it was just so empowering that we have this within us. And I think it's as simple as it is that we actually have this access to it. But in the techniques that we're taught, we can actually really tune and fine tune that. And it was incredible. You can shift your state so quickly, and you can teach yourself that.
That's exactly right. So what did you teach? What did you do? What were the images you used?
Visualization techniques of safe places and beautiful forests. So I had my safe place. And then it was a lot of physical touch cues as well from my husband. So it was, ups and downs of the back, and bringing myself into a more of a nervous system regulated state. And then speaking through stories. So hearing him also talk to me around that visualization. So it was just anchoring me back into those techniques when I felt like I was coming back out of it. Yeah. So
that's wonderful. And, the interesting thing is that people fear hypnosis, that somebody's taking control. And you're telling a story of someone who took control, who was more in control of yourself, because you could focus on things that gave you a sense of comfort and shifted your focus away from the discomfort that can come with delivering a baby. That's wonderful. So you didn't feel controlled or out of control. You felt more in control.
Absolutely. Right? And empowered for our own resources. And I think what we need to do sometimes is remove those higher cortex activities where we actually then have more access to what we can underneath that. And that's what psychedelics do for some people as well, So it's, we have within ourselves. Yeah.
That's right. Well, there's some real similarities. What we found using functional magnetic resonance imaging with people who are hypnotized is that three things happen. One of them is very similar to what happens with psychedelics. You sort of fragment yourself, and with psychedelics, well, you kind of get over yourself. You suspend yourself in hypnosis. The more you're using your prefrontal cortex in hypnosis, the more you're suppressing activity in the default mode network, or what I call the my fault mode network, the part of your brain that tells you, oh my God, what's happening? I can't deal with this. And instead, you surprised yourself, and you did. And the second thing that we see is that people turn down activity in the dorsal region of the anterior cingulate cortex. The cingulate cortex is like a C on its ends in the middle of the brain. And the anterior portion is our alarm system. It's part of the salience network. So you hear a loud noise, you think, oh my God, what is it? That's the salience network kicking in. In hypnosis, you turn down activity there. It's like, I'm just going to shut down the alarm system and get more comfortable and pay attention to what I want to pay attention to. And as a naturopath, it would interest you that in the hypnotizability is correlated with the amount of gamma-aminobutyric acid, inhibitory neurotransmitter, in the anterior cingulate cortex. So you can be your own little pharmacy. You can secrete more inhibitory neurotransmitter in the part of the brain that normally is the alarm system. And the third thing is you have more connectivity between the prefrontal cortex and the insula. The insula is a little island of tissue in the middle of the front of the brain that is a mind-body pathway. So it's the pathway by which the brain controls the body and the body reports to the brain, interoception. So in hypnosis, those three changes happen in the brain, and they give you more control over sensation. They help you disconnect from your usual expectations of trouble, and they turn down your alarm stimulus so that you can be comfortable the way you were. Instead of worrying, oh my God, what's happening to my body, you were going to a safe and comfortable place and mastering it and communicating with your husband in a way that he could make you feel good instead of being left to feel bad.
Yeah, absolutely. And you come out better at the end, and it's much to say for, as we talked about, medications, you're not always coming out better at the end.
No,
Yeah.
that's right. You're hungover.
Absolutely.
Yeah.
So with hypnosis, is there anything where you would say that there is a certain subgroup of people or a certain conditions where you wouldn't approach hypnosis with?
Well, in general, no. I mean, I think if people are very fragile, have had psychotic episodes, maybe that hypnosis might just let loose something that they're desperately trying to keep a handle on. But by and large, the real differences are that there are stable differences in hypnotizability and people's ability to use hypnosis. So all in all, about 2/3 of the adult population are at least somewhat hypnotizable, and about 20% of them are extremely hypnotizable. We call them the poets. They get lost in movies, lost in music. They always are, they're empaths. They usually connect very well. They can see things from the other person's point of view, sometimes better than their own point of view. That can be a problem. But they can very rapidly transform their experience and just feel different, feel better right away. I had one woman who was 7 months pregnant, had terrible low back pain and real damage to her lower back. And of course, as the baby grew, the weight she was carrying got worse. She got in more and more pain. They tried a nerve stimulator, it didn't work. And her pain when we started was 7 out of 10. And after a few minutes, having her float in a warm bath, which gave, in her imagination, which gave her relief when she actually did it, her pain was down to 3. And I said, that's great. And she looked really angry. And I said, what are you so angry about? She said, why in the hell are you the last doctor I got sent to instead of the first? So if you've got that ability, you can either use it to focus on how miserable you can be, or you can use it to make yourself feel different, feel better. People in the mid-range of hypnotizability will have an experience, and then they'll kind of step back and reflect and say, is this for real? What's going on here? And they need to learn over time to recognize and accept what they're actually able to do and to be surprised by it, which is fun. I love that when people get surprised. I couldn't believe that, And then there's about 15, 20% on the low end, we call them the researchers, who just aren't very hypnotizable. But there's no harm in trying hypnosis. The worst thing that happens is they're disappointed. It didn't do much. But we couple the hypnotic trance itself, being in this altered mental state, with the way we approach problems. People who use hypnosis have a favorite saying, which is the worst thing you can do is tell somebody, don't think about purple elephants. That's what you think about. So don't fight the pain. I have people in hypnosis transform the pain the way you did when you were giving birth, or I have them contemplate their body rather than being frustrated with your body because you have chronic lower back pain or because your cancer is causing you pain. And every time you feel the pain, you think, oh my God, I have new metastases. I'm going to die sooner. You have sympathy for your body the way you would your child. Would you get frustrated or angry with your child who was hurting and in pain? No, you'd soothe them, you'd hug them. But if you're constantly overreacting negatively, the pain just gets worse. It annoys you more. So I just say, contemplate a certain amount of sympathy and caring for your own body. Adopt a different point of view in relation to your body. And even people who aren't hypnotizable, who aren't able to modulate the pain experience, the sensation very much, can still modulate the suffering by not making it into a battle, but just saying, I want to help my poor body deal with this as best it can.
Yeah, absolutely. Sympathizing with us. It's almost frustrating hearing of this and then the huge body of research and the huge expanse of what you've experienced in clinics and patient care, and then not still knowing. And my next question is, what's still frustrating about what you hear of people speaking of, and right at this moment, has it come a long way, or are we still at a point where there's not a great acceptance around hypnosis?
Well, I'll tell you, Jody, that's why I started Reverie about 4 years ago. I was sort of being a Boy Scout about it. I thought when I started my career, build it and they will come. Do enough research, publish enough papers, document that it works, document how it works. And it's not just me. I have a number of excellent colleagues who are doing the same thing. Mm-hmm. And I thought if we finally prove it this way, people will get it and will accept it. And that just hasn't happened. We published a paper in the Lancet, leading British medical journal, in 2000, randomized clinical trial of people undergoing subcutaneous intraarterial injection and catheterization. And we had 241 subjects randomized into 3 conditions: either standard care, which was just press a button and you'll get opioids in your blood; nursing support, so a friendly nurse comforting you; or learning self-hypnosis. And by the end of 2 hours, the procedures were about 2.5, 3 hours. The pain levels in the standard care group were 6 out of 10. In the nursing group, they were 3 out of 10. In the hypnosis group, they were 1 out of 10. And the hypnosis group was using half the opioid dose that the standard care patients were. So less analgesic meds, but far less pain. Mm-hmm. And we looked at their anxiety scores. It was 7 out of 10 in the standard care group, 3 out of 10 in the nursing group, and 0 in the hypnosis group. I thought they'd all died or something. They were just so comfortable. The procedures got done 17 minutes faster on average in the hypnosis group. Oh. And they had fewer procedural complications, problems regulating blood pressure and other things. And I thought, if I published a randomized trial like that in the Lancet, and what I was doing was a new drug, everybody would be using it now. And then I just thought, no amount of evidence is going to make the difference. It's just not going to do it. So ever since then, I've been trying to find other ways to just offer it to people, because we understand that the movement in the United States toward integrative medicine, and I run our Center for Integrative Medicine at Stanford, Americans spend more money out of pocket on integrative care than they do on mainstream medical care. They make more visits to integrative care than mainstream care. But it's the patients deciding they want to do it. It's not their doctors telling them to do it. Doctors have been less negative about it than they used to be 20 years ago, but they don't recommend it. And so I just thought to myself, I've done as much of that as I'm going to do. I could do it for another 50 years, and that's not going to move the needle. So what I'm trying to do is go direct to consumers, direct to people who can see for themselves how much they can benefit for it. And Reverie, we've had about 800,000 downloads. We're finding that people get 4 out of 5 of our users get an immediate reduction in stress, in pain. They sleep better. And so within 10 minutes, you don't have to wait and decide, is it going to help? Isn't it going to help? You can feel it for yourself. Mm. And so I just thought, I just want to make it as widely available as possible to people. So all I have to do is go to the reverie.com website, or go to the App Store or Google Play and download Reverie and see what it's like. The first week is free. You can try it and see if it helps. And the worst thing that happens is it doesn't help, but most of the time, 4 out of 5 times, it does. And so I just thought that's going to be my legacy. I want people to have it available to use it whenever and wherever they want. And that's the nice thing with apps. You got a smartphone, you can do it. And so, because it has been hard to find good, well-trained physicians and psychologists and dentists and others who use hypnosis, and it's not hard to find the app. So I just decided that's what I want to do while I can. It's just help people learn to do this for themselves.
Yeah, that is incredible. And as everyone will know now, backed by the most amazing career and research. And how can you ignore that? I think it's down to, this immediacy of what we expect of society, isn't it? I think we want things and we think things in a pill form or, the easy route. And this doesn't have to be a non-easy route,
No.
but they just give it a go. People are sort of resistant before they've even tried, unfortunately.
Right.
Yeah.
Well, there are some, they're either afraid of it or they don't want to work at it, although it's not, most people find it pleasant actually to do it. But I think it's the mental equivalent of physical exercise. Cardiologists will tell you that if you eat, you control your diet, you eat good things and don't eat bad things, and you get regular exercise and you maintain your muscle mass and your circulation, that'll do you a lot more good in the long run than waiting till you have the myocardial infarction and getting on digoxin or other drugs that may keep you alive but have their side effects. And sometimes you got to do both, but a lot of times just taking care of your body from a physical point of view is the most effective thing to do. And the same is true mentally, that you can learn to develop your use of your brain to help your body do better and feel better.
Yeah. And Reverie, it's an easy thing for physicians, for practitioners, for anyone client-facing or patient-facing will be able to suggest and give just very quickly without having to spend sessions on, which is then that's empowering them to take care of their health. So I absolutely love that. Absolutely love that.
I'm glad. That's great. Yes, it doesn't take a whole lot of time for the clinician to recommend it.
Absolutely. So I wanted to sort of divert a little bit into your research on cancer. And I know there's a big component of that in 1980s on women, breast cancer in women. And there's a huge influence on what the work was that you've done since. So talk us through what there's been in terms of discoveries and where we shifted towards that support for cancer patients.
Thank you for bringing that up. I've always been interested in existential issues and how people face even ultimate questions of threat and disease progression and death. And my colleague and mentor, Irv Yalom, who wrote the classic textbook on group psychotherapy and who is still around at 93, helping people, and asked me when I first came to Stanford, he helped to recruit me there. He said, I'm getting together a group of women who are dying of breast cancer. And I'm meeting some resistance, but I want to see what we can do. And because we had oncologists then who said, you're going to demoralize these women. They're going to, the median survival then was 2 years with metastatic disease, and they're going to see one another die, and that'll demoralize them. And, I sort of get the concept, but on the other hand, death is not a novel concept to a breast cancer patient, to a cancer patient, and these were women with metastatic disease. And I thought, well, let's do it carefully and see what happens. So we found that these women could face one another getting sicker and dying. They grieved, but they also, one woman said that being in the group and talking with these women who were dying is like looking into the Grand Canyon when you're afraid of heights. If you fell down, it would be a disaster, but you feel better about yourself because you're able to look at it. I can't say I feel serene, but I can look at it. And they weren't so alone with it. It's different to talk about your fear of death and dying at 3 p.m. with a group of 9 other women who are doing the same thing and doing it at 3 o'clock in the morning when you can't sleep and you wake up. Because we comprehend death in part as the ultimate isolation, being alone. You got to walk that lonesome valley by yourself. And so we found that these women felt better about themselves. They didn't have to suppress their feelings. It wasn't being strong to pretend it didn't bother you that you had breast cancer. They strengthened themselves. There was one woman in the group, lovely woman, who clearly was getting sicker and more frail. but she came in every week beautifully dressed, matching accessories, hair done just so. And she said to the group one day, I'm wondering if maybe you're getting tired of me because my husband, he's a banker, but he's not a teller. He doesn't talk. And I think he's had enough, and maybe I should just shorten my life. And I said to the group, I think she's asking us a question. Are we tired of her being here? Does it bother us to see her getting sicker? And she got powerful feedback from everyone about how much they admired her and how much dignity she had in facing what she was facing. Well, she did not shorten her life. She died about 3 months later, and she had a provision in her will to send a bus to the building where the group met to take everybody from the group to her memorial service. It just so impressed me that people could strengthen themselves, not weaken themselves. And they learned self-hypnosis to control their pain. And in a randomized trial, the women in the support group had half the pain a year later than the control group did on the same and very low amounts of medication. The real surprise was that there was a lot of talk about imaging, your immune cells killing your cancer cells, and would that cure cancer? And I was pretty skeptical about that. So I found out what happened to the women in both groups. And it turned out that the women randomized to get a weekly supportive expressive group therapy actually lived 18 months longer than the control group. It wasn't trivial. It was like a real deal. And we and others have been studying that ever since. We published that in the Lancet. Lancet had the courage to publish that. And there was an editorial commentary by someone, an oncologist who wrote, it isn't the treatment on offer that determines the best care for patients. It's the results. And whatever this was, these women seem to do better. And there are a number of we did a repeat trial 15 years later. We didn't get quite the same results. The women who lived longer in this case were the ones who had estrogen receptor negative tumors that don't respond to hormone receptor blockers, which had become popular in the interim. So I think there were other reasons why people lived longer, but there was still some evidence that they did. And the meta-analyses now show an effect of emotional support on survival. There was a paper published in the Journal of Clinical Oncology from Dana-Farber Cancer Center with like 700,000, 5 years worth of US cancer patients, showing that being married was associated with an overall 4 months longer survival than for unmarried cancer patients. And as you might not be surprised to know, the effect was greater for men than for women. For women, the advantage of being married was not as big as it was for men. So if you're a woman, if you have a woman as a partner, you will do a lot better, whether you're a man or a woman, than if you're a man. But we looked at some of the physiology of that. We found that women who had chronic depression with metastatic breast cancer did not live as long ultimately as those who were not depressed. We looked at patterns of cortisol, stress hormone, that typically is high in the morning, goes down in the morning and into the afternoon, and is quite low by the time you go to sleep. Ones who had the flat cortisol pattern, where it did not decline throughout the day, who couldn't suppress that stress hormone, ultimately did not live as long as the ones who had the normal diurnal pattern of cortisol. And we published that in the Journal of the National Cancer Institute. So clearly, emotional support, stress management are variables that can have an influence on how the body deals with cancer. And why should that be so surprising? But a lot of people had, and some still do, have trouble accepting that. But what I felt good about was, my patients would joke with me. They say, "Am I living longer yet, Spiegel? What's happening here?" And there was one lovely woman who we visited her shortly before she died in her home. And she came late to a group one day, and she said, I was worried I was going to be late, and you like to start the group on time and end it on time. And I thought, who cares what Spiegel thinks? I'm going to be late. That's it, And I said, "You're learning things much too well here. You're too much with it." And she did something very interesting. She was a journalist, and she was going to leave something in her will to help train young women to be journalists. And she thought, why should I wait till I'm dead? I'm going to start it now so I get to meet them and see what happened. And it was by facing her own death, she enriched their life, she enriched her life. And so I think giving people new and better means of coping can have an extraordinary effect on their quality of life and sometimes even the quantity of life.
Oh, pardon the interruption. This podcast is also proudly brought to you by Troscriptions, the leading provider of precision dose, physician-formulated pharmaceutical-grade formulas in the form of a buccal troche. And we've been talking about the importance of stress management and quality sleep, and that's where TroZ comes in. And this unique formula is designed to promote deep, restorative sleep, helping you wake up refreshed and ready to take on the day. With its precision-dosed blend of ingredients, TroZ ensures you can enjoy better sleep without the grogginess, making it the perfect companion for these looking to optimize their mental and physical well-being. And I used it on a recent camping trip, and I can for sure say that it was enabled me to get a pretty good sleep in a tent. So I love TroZ myself too. Ready to experience the benefits of the precision dose sleep? Then you can use pod 10 to get 10% off your purchase at troscriptions.com. So now back to the show, armed with the knowledge to live smarter, sleep better, and thrive with a buccal TroZ.
Goodness me, you're making me cry, David.
Good.
Emotional here.
I'm glad to hear that. I think that's a compliment.
To experience humanness, as I call it, in this way, it's so enriching for a career, for a path, for a passion, to make everything worth it. And I experience this in my clinic as well. Yeah,
I'm sure you do.
Yeah, the stress is a huge word, and I think I sort of caveat over because there's a good link here, and it's an incredible part of, obviously, with cancer, obviously it's the imminent death and mortality that sort of creates more of the stress for us. But then everyday life is increasingly demanding and overwhelming and overpowering for all these components that we have to fit into our day. And I was saying this to my husband the other day. I said to him, I'm like, not that it was, not that I'm depressed or anything. I just said, wow, there is so much that we have to be doing in our life, paying bills, doing this, doing that. There's just so many components. And where is the break? Like where do we actually have a rest? Well, we don't. We don't have a rest. We have to create that space for ourselves and to create the tools and the tricks and the every apps and all these components that we can actually gain greater support within our life. But we have to do that ourselves. And for me, stress in a healthcare setting is one of the major causes of everything I see. But it's so flippant to say, got to reduce your stress, guys. Just reduce your stress. Everyone says how.
There's one way to do it: death. If you want a time when you're not stressed, that's the time. And otherwise, I think it's a matter of how you address it, how you handle it. Does it just knock you around, or do you say, okay, I don't like this, I've got to figure a way to deal with it, and deal with it? And then you can feel stronger. Nietzsche said, anything that doesn't kill me makes me stronger. You face it, you face it and deal with it, and you can feel better about yourself for having confronted it and dealt with it, even though it can be unpleasant and fatiguing and a lot of other things.
Yeah, it's the growth, isn't it? And I think, these sorts of interventions create that resilience, that coping strategy, that support, so you can expand and then you can become better and you can grow and you can, develop and move forward. And we can't stay stagnant as humans. We don't create anything from that. And I think it's beautiful in that way. But we also have to make choices with our boundaries, don't we? And have those tools there.
Sure, absolutely. But we're social creatures, we survive because we help one another. And, the human infant is the most vulnerable of any baby mammal. And if it doesn't quickly attract care and love from mother and father and others, it's not going to survive. So, social connection is a huge component of our survival.
Yeah, absolutely. And I think that's where sort of my next question is, what do you see obviously in the future of, psychiatry in your field, but also where have you seen and learned lessons from in the last sort of 5 years? Because COVID created that real removal, and that, I believe, created a huge increase in stress and anxiety for society.
You bet.
Yeah. I guess that's on that, and then future directions where you see.
Well, yeah, that's been a terrible time, and it's turned one of the major sources of support and pleasure going out and being with people into a threat. So if you want to produce, a world full of phobics, just make the thing that used to comfort them and give them pleasure into something that threatens them and kills a lot of them. And so it's been a terribly difficult time. And, the world, when people ask me how I'm doing, I say I'm doing a lot better than the rest of the world. It's been catastrophic. And I think some of it has to do with the pandemic, that it forces us apart, and it makes everything you do threatening and worrisome. And I think, and we've had to take care of ourselves and avoid a lot of other people you would otherwise much rather be with and be alone. And so I think it's been just a very painful and difficult time. And I think a lot of the suspicion and misery and aggression and other things, the average rate of anxiety disorders has gone up 5%. And that's a whole lot of people in the world. It's now 25% of Americans have an anxiety disorder. It used to be like 20. And so there are a lot of people been pushed over the edge into, mental illness and suffering as a result of the negative effect this has had on our lives. It's not been fun. And so again, that's one reason that I started thinking about Reverie, is that I wanted to reach out to people who couldn't come into my office and who were afraid to, get in a bus or in the subway or something because of the real risk of contracting COVID. And so I thought there's got to be ways to disseminate what we've learned can help people that don't involve physical contact. So I think we hopefully are becoming more creative in reaching out to one another in ways that can be helpful, but not carry unnecessary risk of getting sick.
Yeah, no, absolutely. And the increase in cancer rates as well has blown me away. And not directly caused by certain compounds or medicines, but more so from the removal of community. And I feel that that's really influenced illness and chronic illness. Yeah.
Yeah. Well, and if you think about it from the point of view of my concern that you've been asking about, is somebody who approaches you and wants to help you with hypnosis, a friend or a foe, are they going to help you and teach you how to do something that will help you feel better, or are they going to make a fool of you and control you and take over? And it's that same fundamental question we have in taking full advantage of our social capacities for engagement, that can we find ways to help one another rather than harm or scare one another. And we need a lot more of the helping and a lot less of the harm and fear.
Absolutely. And supporting, and that grows each other's resilience at the same time. Yeah.
It does. It does. You feel better about yourself. I mean, that's what I see this time and again in the cancer groups. They come to feel like experts in dealing with cancer, that I know something now that can help all of you other women in this room. Because I learned, for example, that after I get a scan, you can ask the tech whether it looks worse. It's not the final conclusion, but it's not 2 weeks of waiting breathlessly to see what the result is going to be. You have a pretty good idea what it's going to be. So there are tricks they taught one another to just cope better. And they felt like they were getting away with something, but they were, and it helped them.
Yeah, no, absolutely. It's just incredible, David, and I'm in awe of your work and just the capacity of reach of what you've created over, your career so far. So I want to sort of ask, I want to wind up because I don't want to keep you too long in your evening. We always ask this question at the end of our podcast, and it's how you see and what your sort of, I guess, are the practical tips or opinion on how people can live, and this is very relevant to the whole podcast, however we summarize at the end, how people can live smarter, not harder.
Well, I think I have some sort of old ideas and new ideas. When I was in college, I was a philosophy major. I read Soren Kierkegaard, who really moved me, existential philosopher. And his main message was, don't get trapped in some rigid image of who you think you are. And he tells the Abraham Isaac story and says that if you look at it, Abraham was willing to sacrifice his son to be what God promised him, which is to be the father of a great race of people. And it was only when he was willing to give that up, it looked awful, he was going to sacrifice Isaac, but that meant he was giving up his path to God's promise. And lo and behold, Isaac survived, and he did become the father of a great race of people. Kierkegaard is saying we get trapped in our fixed images of who we are. He contrasts him to Agamemnon, the knight of infinite resignation, who did sacrifice his daughter Iphigenia to get the gods' support in his war. And he's saying we are creatures who can relate freely to ourselves and to one another, but we get trapped in very rigid, fixed views of who we are. And one of the things I love about hypnosis, to get to the new part, is people surprise themselves. They just think, wow, I didn't think I could do that. You didn't maybe think you could have 2 kids hypnobirthing. And I love that. I just love the idea that people can discover that they can do and be something they didn't think they could do or be. And often, in psychiatry and psychotherapy, we felt we had to take the long path of understand how you got to be this way and what your parents did to you, or take a long series of steps, bit by bit, changing. And the cool thing about hypnosis is you can cut yourself loose and try out being different in a couple of minutes in self-hypnosis. See, what would it be like if I was somebody who wasn't going to be intimidated and frightened by this pain or by this fear? If I had a woman who was a successful businesswoman but had a terrible dog phobia, and it was ruining her life. She couldn't go out. She was terribly scared. And she said, when I see a dog, I just stand there and wait and see what it's going to do. And I said, well, if one of these vice presidents who reports to you walks into your office, would you just sit there and wait to see what he's going to do? She said, hell no, I tell him what to do. So I said, so why don't you try out being that same woman, only with a little 4-legged creature? And she just surprised herself that she was able to conceive of herself in that situation differently. My father used to treat dog phobias, and this woman had turned over a table at a fancy dinner when a little French poodle walked into the restaurant, and her husband said, get fixed or get out. I've had it. And my father got her hypnotized and had her have a friend hold a dog, promise not to fool her, and think about the difference between wild and tame animals, and think of the dog as a tame animal. And eventually, with great trepidation, she went and pet the dog. And she said, thank you, doctor. I really feel different. Well, he called her up about 6 months later to see how she was doing. And a little boy answered the phone. And he said, is your mama there? And he said, yes, who's calling? And my father said, Dr. Spiegel. And there was a long pause, and the boy said, that's funny. Spiegel's in heat. She had bought a dog and called it Spiegel. So people surprise themselves. And so, it can be fun. It can be serious philosophical discourse, or it can just be fun to try out being different and use that as a therapeutic tool. And that's what I've been doing my whole career, and I love doing it.
Yeah, that's just amazing. Well, Dr. David Spiegel, it's been an absolute honor. Can you tell everyone where to find, obviously we know where to find the Reverie app, but any research or links or anything else that you want people to know about?
Well, we have our research described at the center. The link is the Center on Stress and Health. That's the Stanford Center on Stress and Health. And you can look up articles that we've published over the years on research on how hypnosis works and comparing it to other treatments and see how well it does. But a lot of that literature is summarized on the Reverie.com app. So that's a good place to start, is to look there, look at the background research, and then you can make a choice of what kind of problem you'd like to deal with and try it out. And you'll hear my mellifluous voice. And Reverie is interactive, so that it's not just listen to a recording. I'll say, is your hand floating up in the air? And if it is, we'll go on to something else. If you say, no, it isn't, then I'll give you some more reinforcement about that. So it's as much like being in my office and getting up with hypnosis as I could make it. I used to worry that maybe it wasn't, as good. And then I thought, you know what, if you're waking up at 3 a.m. and having trouble getting back to sleep, you probably don't want me in your bedroom helping you to get back to sleep. But you can hear me. Exactly. And people find it very helpful to get to sleep and to get back to sleep.
Yeah, which is a huge component of health and support. So that's
you bet.
Yeah,
It is indeed.
huge one for a lot of people, and it can be debilitating, completely debilitating to have a tool.
Absolutely.
Yeah.
Yeah, absolutely. And you can't maintain your health well during the day if you haven't had a decent night's sleep, and it kind of is a vicious cycle that gets worse and worse. But you can learn with self-hypnosis to, do what you did when you were delivering it, which is separate your physical arousal from your mental arousal. So you can picture being somewhere safe and comfortable and imagine your body floating in a bath, a lake, or hot tub. And that allows you to drop your fight or flight sympathetic autonomic responses and cue up the rest and digest parasympathetic ones, and just help your body let you go to sleep.
Oh, I could talk for hours with you.
That's really nice. Yeah.
We will link to all of that. And
Great.
thank you so much for your time today.
You're most welcome.
Honored to have you on the podcast. And there is so much benefit for everyone who is listening in to this, and then ongoing benefit for Reverie. And I'm going to go and download this now as well, so I can have it
Terrific.
on my hot tips when I'm suggesting to clients too. So thank you so much.
You're most welcome. Well, thank you so much for having me. I greatly enjoyed talking with you.
Yeah, no, it's been
your
a pleasure.
listeners.
And enjoy the rest of your night. Have an amazing night.
Thank you. Thank you. You too. The rest of your day.
Thank you.
Bye-bye.
Thank you for joining us on another episode of Smarter Not Harder. We are deeply grateful for Dr. David Spiegel for his time and sharing his expertise on hypnosis, mind-body medicine, and the powerful impact these interventions can have on chronic illness and cancer care. If you found today's conversation insightful, don't forget to leave us a review, share, and like the episode on Apple Podcasts, Spotify, or wherever you listen. Your feedback helps us to continue delivering this amazing content. So we hope this episode has provided you with new tools to explore mind-body integration, stress management in your own life, and check out the app Reverie. So we will link to that in the show notes as well. So stay tuned for more episodes where we continue to bring you 1 cent solutions to those $64,000 questions. Until next time, stay curious and keep learning, and we'll be back soon.